Liu, who at the Wuhan University of Science and Technology. And that's precisely where our study takes place. We're going to look at risk-taking in Wuhan in these strange times. Now, it goes without saying that the coronavirus pandemic has become an unprecedented shock to economies around the world. And moreover, it's really been a significant shock to individuals and households. Now, understanding how individuals internalize this shock and perceive it, and how they potentially update their expectations and in turn their behavior, is going to be crucial for determining if the policy responses that we are putting forward and acting on are actually appropriate. On one hand, shocks to individuals' risk-taking may have immediate impacts on, for example, investment behavior or consumption. They may have longer-term effects. It may be kind of medium-term as well. On the other hand, the intensity of such an experience and exposure is likely to vary considerably depending on how individuals interact with the pandemic itself. And this may have differential impacts on economic choices and in turn on different outcomes. What we're going to study in our paper is how individuals' tolerance for risk may be affected due to their exposure to the pandemic. We know from the literature that formative experiences are likely to have a profound effect on future risk-taking, whether that's if individuals refrain from risky situations in the future, or if they actively kind of rebalance out of risk after an experience. We also know that individual beliefs about mortality and about life longevity and so on affect economic choices and decisions, but we don't really know that much about how individual preferences and beliefs may acutely change during an experience or a crisis itself. What we do here is we provide evidence that more closely experienced shock, so higher exposure to the coronavirus pandemic, during a crisis can acutely affect risk-taking, and we're going to argue that it's at least partially driven through a channel of beliefs and optimism, really. So let me tell you about our setting. We conducted the first wave of our study with, or survey rather, with graduate students at the Wuhan University Science and Technology on risk-taking, luck, and beliefs in mid-October. This was obviously for a different project than the one I'm presenting today. This was weeks before any initial reports of the coronavirus in China. As planned, semester ended and the winter break began in mid-January, January 11th. At this time, there was kind of no real concern about any sort of health issues or crisis in China, and it surely was not a global pandemic. So students in our setting were allowed to return home as planned for kind of New Year celebrations. This had changed significantly by January 23rd. So the province of Hubei, where Wuhan is the capital city, was essentially starting to get locked in, and public transportation to and from the province was closed. Quarantine conditions took hold, and this was kind of gradually increasing throughout February. By February 15th, Hubei was kind of a state of complete lockdown. And in February 28th, we administered a follow-up survey to the same group of subjects, and we had basically a 90% retention rate. During our second wave of the survey, this was kind of fielded online, obviously, so we were able to capture precise geo-coordinates of where subjects were when they actually took the survey. And this gives us two sources of variation. Obviously, this variation in time from wave 1 to wave 2, and then this kind of variation across China, which gives us different intensities of exposure to the pandemic. Here you see a map of China with the province of Hubei outlined and the capital city of Wuhan. Now, our subjects are, about half of them are located within Hubei and the rest of them are distributed around the country. You are likely to know that Wuhan is essentially ground zero for the coronavirus and has been kind of one of the largest hotspots in the early days of the manifestation of the pandemic. You might not know by how much. So what we're plotting here is just the cumulative infections and deaths in Hubei compared to all other provinces across China. So you see essentially that the rate of deaths on the right axis and the rate of infections on the left axis is essentially fivefold what they were across the rest of the country. And this kind of dashed line just shows the date of our follow-up survey. Now, we're going to use this as a source of variation in our empirical approach, obviously. In our 2 survey waves, we have some measures which we only measure cross-sectionally because we added these to the second wave of the survey in early March. And then we have measures where we have a kind of panel dimension where we measure them in wave 1 and wave 2. In both cases, our variables of interest are kind of location dummies for individuals who are located directly in the city of Wuhan, and individuals who are also then located in Hubei, but not in Wuhan. And this is kind of our proxy for exposure to the pandemic. The argument is individuals in Wuhan city are much more exposed to the pandemic compared to individuals in Hubei, compared to individuals in the rest of the country. Now, wave 1, we collected basic demographic information, survey questions on general willingness to take risk, 13 questions on individuals' beliefs in their own luck and individuals' beliefs in kind of general luck. We captured essentially a couple of questions asking individuals how they would rank themselves in terms of investment performance and luck, and then a number of questions related to sense of control over these types of outcomes. In wave 2, we asked all of the same questions. We additionally added a risky lottery allocation task, so subjects are able to allocate $1,000 between a risky lottery and a risk-free lottery. And then some other questions about subjects' experiences with the pandemic in general. Now that's where we will start. We find first off that subjects with higher objective exposure to the pandemic from being quarantined in Wuhan relative to Hubei and relative to other provinces are more likely to state, yes, there are confirmed cases where they lived. They're more likely to state there are confirmed deaths where they lived. They're more likely to state there are more cases within their family and friends. And they're more likely to say that they are more likely to become infected with COVID-19 in the future. Having established that these individuals have higher kind of subjective beliefs about their exposure to the coronavirus pandemic and arguably higher objective exposure, we want to understand how this affects risk-taking. So we first look at our hypothetical allocation elicited in March 2020. What we find is that subjects who are located across China invest about a third of their endowment into the risky assets, and this decreases monotonically based on their exposure to the coronavirus. So individuals in Hubei allocate about $70 less, or Wuhan, by the way, sorry, and individuals in Wuhan allocate 150 or so less than individuals across other provinces in China. And this is an economically significant effect. It's about a 45% less investment. Yeah, I can skip over this. What we find when we look at general preferences for risk as measured by these general kind of willingness to take risk survey questions, we find something different. So we find that all subjects, regardless of their exposure, essentially uniformly decrease their willingness to engage in risk. And this is, again, a pretty significant drop when you look at the mean pre of 2.5. This is about a 0.6 point decrease. But what's interesting is that these decreases are kind of general across different levels of exposure. Now, what might be behind this differential effect, right? So why do individuals take less, why do these experiences affect risk-taking on this monetary gamble, but not necessarily these general risk preference survey measures? It could be that general risk preferences are not entirely driving monetary risk-taking, but rather there's also this idea about beliefs or individuals' optimism. So what we're going to do is look at how these measures evolve over time. And we essentially find that individuals with higher level of exposure and kind of more experiences with the pandemic are more strongly reducing their beliefs, for example, in their own individual luck. So this is a significant decrease compared to individuals in other provinces in Hubei. Subjects from Wuhan are also more likely to say that they would have worse luck compared to others in terms of investment outcomes, and they're also likely to show lower reduced rates of sense of control. In general, subjects with higher level of exposure are kind of making these downward adjustments in optimism. And we find there's some kind of slight evidence, at least, that these carry over onto beliefs about the economy and social conditions as well. So individuals in Wuhan compared to other provinces are also less likely to agree with the statement that the economy will improve in 1 year. They're less likely to agree with the statement that the environment will improve, and they're also more pessimistic about their own health improving. Finally, again, this last graphic has kind of large standard errors here, but subjects in Wuhan are also more pessimistic on the expected returns of the Shanghai Stock Exchange Composite Index. I'm probably out of time, so let me wrap up. In general, what we do here is that we use repeated measures of risk-taking and beliefs from subjects in Wuhan, China, and we kind of measure this effect from pre to the peak of the crisis. And we find that exposure strongly affects risk-taking, but not so much for general measures of risk appetite. However, we also find strong decreases in optimism and beliefs, which are related monotonically to individuals' exposure as well. These seem to carry over to beliefs about the economy. And our argument here is that short-term risk-taking or changes in short-term risk-taking may be more influenced by optimism and beliefs compared to general preferences for risk. So thanks a lot.